Former State Health Director Dr. Amy Acton, of course, stepped down 5 months ago. Her first replacement withdrew her name less than 6 hours after being named to the position. Today, Governor DeWine announced the CEO of the Ohio Bureau of Workers' Compensation. Stephanie McLeod will be the new director of ODH. NBC4's Eric Halperin is live tonight at the State House. And Eric, the choice already being questioned by a number of people, right?
Colleen, Governor DeWine made his announcement around 2:30 this afternoon, and just about 2 hours later, NARAL Pro-Choice Ohio was already criticizing the decision. A new face at Governor Mike DeWine's COVID-19 update. The governor announcing Bureau of Workers' Compensation CEO Stephanie McLeod will now be the new director of the Ohio Department of Health.
So in Stephanie McLeod, I have someone who I have a great deal of confidence in. I've known her for many years. She's a superb administrator. She will do what needs to be done every single day.
But not everyone's happy about the new director. Shortly after the announcement, NARAL Pro-Choice Ohio sent out this statement saying, in part, McLeod has long been an opponent of abortion access, and that, quote, DeWine has abandoned his sacred responsibility to put the health and safety of Ohioans over his personal agenda to eliminate abortion access in our state. Healthcare should never be politicized like this, especially during a pandemic. I asked the governor's press secretary if the governor or McLeod have a response to the pro-choice group's statement, and he declined to comment. Though McLeod is not a doctor, Governor DeWine says she's been involved in the pandemic efforts for 2 months.
We need to have a key physician, though, at the Department of Health who has a direct line to me and someone who I can rely on every single day.
And with that being said, there was another new face at the update. The governor announced Dr. Bruce Vanderhoff will be the new chief medical officer with the Department of Health.
Because I'm confident that together we really can overcome COVID-19 and then move on to work to make Ohio one of the healthiest states in the entire nation.
Dr. Vanderhoff had been senior vice president and chief medical officer at Ohio Health since 2008. In his introduction, Governor DeWine called the doctor a highly regarded physician and administrator and a nationally recognized healthcare leader who helped prepare Ohio Health for the threat of Ebola and H1N1. Later, the governor was asked if either McLeod or Dr. Vanderhoff have infectious disease experience.
We'll have to ask him what his infectious disease experience. Doctor, you still on there?
Dr. Vanderhoff explained the infectious disease work at Ohio Health was reported to him, and he worked very closely with the infectious disease specialists.
I am very, very confident not only in my ability to connect with the infectious disease experts around the state of Ohio, but also around the nation. And my own medical background means that I feel very comfortable in interpreting not only their guidance, but also the medical literature.
And on Dr. Vanderhoff and McLeod together, Governor DeWine says they are the right combination. He also announced some new other senior team members for the Department of Health who he says are also very important. Live on Local 3 at the State House, I'm Eric Halperin, NBC4.